Hello, so this is Fisher. He's 4 and he just started his treatment. I think he was the second kid to watch the space video, and we've seen numerous MRI videos and different things to try to get him ready for different procedures he needed to have done, and they scared him a little bit. So we didn't find them the best, but with this one, we found it super helpful to be compared to an astronaut and to be brave, and that it's okay to be nervous while you're getting your treatment done. So we really loved this video and really thought that it was a great job done and really well done, and really helped him going into starting his treatment to feel like an astronaut, and because he does get quite nervous, and we talk about the video almost every time we go into treatment and have found it just to be really helpful. Just with comparison to some of the other videos we've seen. So we appreciate it, and thank you to NASA and everybody for making this video for our kids.
Hi, my name's Alex. I'm 21 years old. In September of 2022, I was diagnosed with rhabdomyosarcoma. I've been receiving great care from Seattle Children's, and as well as recently within the past month, radiation here with Fred Hutch. I was lucky enough to be one of the first people to see the video and kind of experience this NASA's vision first. And I initially was really impressed with just the way that the comparisons were all made. It's really a perfect analogy. Like, as you can kind of see with the video, there's so many different talking points that are, when you're explaining it in terms of radiation, it's a little confusing, but putting it into terms of kind of like an astronaut going on a mission, especially for younger patients, it can really make it more digestible and understandable. For me personally, what I took away the most from the video was the talk about being alone in the treatment room, similar to how an astronaut is alone in like a spaceship. And I will admit, I was intimidated. I don't know if you guys have seen the treatment rooms yet, but I'm in treatment room 4, and it's a very large machine, kind of like twice my size, and I'm a full-grown adult, so you could imagine how that would feel for younger patients. But kind of the main takeaway that I got from the video was that you are alone in that room, but you're not really alone because there's such a good care team that's behind you, similar to how astronauts have their control rooms and everything. There's so many people that you see and that you don't see that are supporting you, and I think that was the biggest takeaway for me, and was really helpful with reassuring my comfort in treatment and making sure I got the best quality of care with that. Thank you.
Hi, I'm Carrie Hanaway, and my daughter Aisley was treated here in the spring of 2021 for a brain tumor that she had. She was only 3 years old, and when we found out she needed to be sedated every day for her procedure, my first question was, isn't that dangerous? And her doctors explained, well, not doing this is not an option for her and for her health. So after a couple of weeks, her doctor, Dr. Moyan, believed in her and knew she was brave enough to go unsedated, and I was pretty terrified, and Aisley was pretty nervous. We did not have the benefit of this program, and we did our best with talking about being brave, having the courage, playing princess songs for her, everything we could. But it is very intimidating. It is very scary. And I only wish that we had a program like this to make it even easier and just more fun. Every moment that you can see your child going through something scary and medical under these circumstances, when you can see them smile and playful and looking forward to running in here every day, just makes it that much easier on the child and on us parents to just enjoy the process while we've got these little ones here with us. So thank you to NASA, to Fred Hutch, to Seattle Children's Hospital. Everything you're doing, it just is so incredible for these little kids and for the whole family.